Blackheads are one of the most common, and most preventable, forms of acne. If you understand why they form and you build a consistent routine that keeps pores clear without irritating the skin, you can dramatically reduce how often they appear and how visible they look. I'll walk you through a dermatologist-style prevention plan you can follow safely at home. This is general educational information, not a personal medical diagnosis, and if you have severe acne, scarring, painful bumps, or persistent irritation, it's best to see a board-certified dermatologist for individualized care. To prevent blackheads, it helps to start with what they actually are. A blackhead is an open come done, which means a pore becomes clogged with a mixture of dead skin cells and sebum, your skin's natural oil. The top of that plug is exposed to air, and the material darkens through oxidation. This is why blackheads look black or dark gray. It is not dirt. Scrubbing aggressively to clean out the black color often makes things worse by irritating the pore lining, increasing inflammation, and triggering the skin to produce more oil as a rebound response. Prevention works best when you focus on 3 core goals: keep the pore lining shedding normally, keep oil and debris moving out of the pore, and avoid irritation that causes the follicle to swell and trap material inside. Most people who struggle with blackheads have one or more of the following contributors: naturally oilier skin, often genetic, hormonal shifts, common in teens, menstrual cycles, stress, and some endocrine conditions, heavy or occlusive skincare or makeup, inconsistent cleansing, either too little or too harsh, environmental occlusion, helmets, masks, chin straps, tight collars, hair products transferring to the forehead and temples, and a routine that lacks ingredients proven to unclog pores. The good news is that blackheads usually respond very well to a steady, gentle routine. Steady is more important than intense. Let's build that routine from the ground up, starting with cleansing. Cleansing is not about stripping the skin, it's about removing surface oil, sweat, sunscreen, and makeup so your treatment products can work properly and your pores are not being reclogged every day. A gentle cleanser used consistently is more effective than an aggressive cleanser used occasionally. For most people prone to blackheads, washing twice daily is a good baseline, once in the morning and once at night. If your skin is very dry or sensitive, you may do better with a morning rinse, or a very gentle cleanse, and a full cleanse at night. If you work out or sweat heavily, add a brief cleanse after exercise. Use lukewarm water, not hot water, because hot water increases irritation and can disrupt the skin barrier. Cleanse with your fingertips for about 20 seconds, focusing on areas where blackheads form: nose, inner cheeks, chin, forehead, then rinse thoroughly. Pat dry, don't rub. After cleansing, the most important prevention step for blackheads is adding a pore-clearing active ingredient in a way your skin can tolerate. The 2 most evidence-based categories for preventing blackheads are salicylic acid, also called beta-hydroxy acid, or BHA, and topical retinoids. Salicylic acid is oil-soluble, meaning it can travel into the pore and help dissolve the mixture of oil and dead cells. Retinoids normalize the way the pore lining sheds, preventing the sticky buildup that forms plugs in the first place. Many people do best using one of these consistently. Some can use both, but not at full strength every day at the beginning. If you are new to actives, start slowly and build tolerance. With salicylic acid, a leave-on product used a few nights per week can be a gentle entry point. Apply a thin layer to blackhead-prone zones after cleansing and drying the skin. If your skin tolerates it, meaning only mild, temporary dryness, gradually increase frequency. With retinoids, start even more cautiously because irritation from overuse is one of the most common reasons people quit, and quitting is what allows blackheads to return. Use a pea-sized amount for the entire face, not a large blob. Dot it across the face and spread thinly. More product does not mean faster results, it means more irritation. Start 2 nights per week for 2 weeks, then every other night for a few weeks, then consider nightly if your skin remains comfortable. Expect a slow improvement. Blackhead prevention is usually measured in weeks to months, not days. If you stop, pores often begin to clog again. Because irritation is the enemy of consistency, moisturizing is not optional. Many people with blackheads avoid moisturizer because they fear it will clog pores, but dehydrated, irritated skin can actually clog more easily and can overproduce oil. The key is choosing a lightweight, non-comedogenic moisturizer and using it in the right amount. Apply moisturizer after your active ingredient has absorbed, or use the sandwich method if your skin is sensitive. Moisturizer first, then a small amount of retinoid, then moisturizer again. This reduces irritation while still giving you the long-term benefits of retinoid therapy. If you are using salicylic acid and feel dry, moisturize right after. Sun protection is another essential prevention step people underestimate. Ultraviolet exposure thickens the outer layer of skin over time, which can worsen clogged pores and make texture look rougher. In addition, many acne-preventing ingredients increase sun sensitivity, and irritation from sunburn can set back your progress. Choose a broad-spectrum sunscreen you can wear daily. If you are prone to blackheads, look for labels such as non-comedogenic and choose textures described as lightweight, gel, or fluid. The best sunscreen is the one you will use every day, because daily consistency is what prevents long-term pore congestion and post-acne marks. Now let's talk about exfoliation, because this is where many well-intentioned routines go wrong. Physical scrubs, especially those with rough particles, can create microirritation and worsen blackheads over time. Chemical exfoliation, when done gently, can help. Salicylic acid is a form of chemical exfoliation that is particularly relevant for blackheads. Some people also like alpha-hydroxy acids, AHAs, such as glycolic or lactic acid for surface smoothness, but AHAs don't penetrate oil as well as salicylic acid. If blackheads are your main issue, prioritize BHA and/or a retinoid. If you want to add an AHA, keep it occasional and do not combine multiple exfoliants on the same night early on. Your skin barrier needs time to adapt. A practical daily routine for blackhead prevention can be very simple. In the morning, gentle cleanse, lightweight moisturizer, if needed, then sunscreen. At night, cleanse thoroughly, apply your chosen treatment, salicylic acid or retinoid on the planned nights, then moisturize. If you wear heavy makeup or water-resistant sunscreen, consider a double cleanse at night. First remove with a gentle cleansing balm or micellar type remover, then follow with your regular cleanser. The goal is not to overclean, but to ensure residue is removed so pores are not reclogged by leftover product. If you want to be very precise, you can schedule your actives like a training plan. For example, you might use salicylic acid 2 or 3 nights per week and a retinoid on 2 other nights, with rest nights focused on hydration. Over time, many people transition to retinoid most nights and keep salicylic acid 1 or 2 nights per week, or they choose one active and simply use it consistently. There is no single perfect schedule. The best schedule is the one that keeps your skin calm enough that you can keep going for months. Let's address a few high-impact habits that quietly worsen blackheads. The first is picking and squeezing. When you press on a pore, you can drive material deeper, rupture the follicle wall, and trigger inflammation that leads to larger pimples, prolonged redness, and sometimes scarring. If you have a very prominent blackhead you are tempted to squeeze, a safer approach is to treat it consistently for a few weeks. Many will loosen and clear on their own. If extractions are needed, professional extraction by a trained clinician is safer and cleaner than home squeezing. The second habit is overwashing or using harsh alcohol-based toners. Stripping the skin can temporarily reduce shine, but it often backfires by disrupting the barrier and increasing oil production. The third is using too many products at once. Layering multiple exfoliants, masks, strong acids, and retinoids can lead to irritation, and irritated skin is more likely to clog and break out. Keep your plan simple and stable. If you want to add something new, add one product at a time for at least 2 weeks so you can tell what is helping and what is causing irritation. The fourth habit is forgetting that hair care is skincare when it comes to blackheads on the forehead and temples. Pomades, heavy oils, and leave-in products can transfer to the skin and block pores, especially along the hairline. If you are prone to blackheads in those areas, keep styling products away from the scalp edges, wash your face after applying hair products if they tend to migrate, and consider washing pillowcases more often. Makeup and sunscreen choices matter as well, but you don't have to avoid them. You simply want products that don't feel heavy and that remove cleanly at night. If you notice your blackheads worsen after introducing a new foundation, primer, or sunscreen, stop that product for 2 weeks and see if your pores calm down. Keep makeup tools clean. Sponges and brushes can carry oils and residue back onto the skin. Also, avoid sleeping in makeup. Even one night can set you back. Lifestyle factors aren't the sole cause of blackheads, but they can influence oil production and inflammation. Sleep matters because poor sleep raises stress hormones that can increase sebum output. Aim for a consistent sleep schedule. Stress management helps for the same reason. Stress doesn't create blackheads out of thin air, but it can worsen the conditions that lead to clogged pores. Regular exercise is healthy, but sweat left on the skin can contribute to congestion, so rinse and cleanse after workouts. Hydration supports overall skin comfort. It won't flush out pores, but it helps you tolerate treatments better. Diet is a nuanced topic, and I like to keep it practical and evidence-informed without making extreme claims. For some people, high glycemic diets, lots of sugary snacks and refined carbs, may worsen acne tendencies. Some individuals also notice acne flares with high amounts of certain dairy products. This is not universal, and you do not need to eliminate entire food groups unless you notice a clear pattern for your own skin. A balanced diet emphasizing fiber-rich carbohydrates, lean proteins, and healthy fats is a reasonable general approach. If you suspect a dietary trigger, change one variable at a time for several weeks and observe. The goal is not perfection, the goal is reducing avoidable triggers while keeping your routine sustainable. Now let's talk about common quick fixes and why they often disappoint. Pore strips can remove some surface material temporarily, but they do not correct the underlying process that forms blackheads, and aggressive stripping can irritate the pore opening. Clay masks can reduce surface oil and make pores look smaller for a short time, which some people enjoy, but they're best used occasionally rather than daily. If you love masks, keep them as a once-weekly supportive step, not the core of prevention. The core is still consistent cleansing, a proven pore-clearing active, moisturization, and daily sunscreen. It's also important to set expectations about pore size. Pores do not open and close like doors. They can appear larger when they are filled with oil and debris, and they can look smaller when they are kept clear and the surrounding skin is healthy. Prevention improves the appearance of pores by keeping them clean and reducing inflammation, not by permanently changing your genetics. That said, many people see a noticeable improvement in texture and pore visibility after several months of consistent retinoid use. If your skin is sensitive, you can still prevent blackheads, you just need a gentler ramp-up. Sensitivity often means your barrier is easily disrupted, so your priority is a minimal routine with slow introduction of actives. Choose a very mild cleanser, moisturize consistently, and introduce either a low-strength salicylic acid product or a gentle retinoid schedule, not both at the start. Reduce frequency if you feel burning, persistent redness, or peeling that lasts more than a few days. A little dryness early on is common, pain and intense burning are not. If you react strongly, stop the active, focus on barrier repair with moisturizer, and reintroduce more slowly. If irritation persists, consult a professional, because conditions like eczema, rosacea, or contact dermatitis can mimic or overlap with acne and require different management. Some groups need special caution. If you are pregnant or trying to become pregnant, avoid retinoids unless specifically directed by your clinician, because retinoids are generally not recommended during pregnancy. If you have asthma or very reactive skin, be careful with fragranced products and harsh acids. If you are using prescription treatments or have a medical condition, check with your healthcare provider before adding new actives. Let's cover mask acne, sometimes called maskin, because it has become a common trigger for blackheads around the mouth, chin, and jawline. Masks create friction, warmth, and humidity, which can increase oiliness and trap debris. The prevention strategy is straightforward: use a gentle cleanser after long mask wear, moisturize to reduce friction, avoid heavy occlusive products under the mask, and change masks regularly. If you are using a reusable mask, wash it frequently with a gentle, fragrance-free detergent and rinse thoroughly. If you are using disposable masks, replace them as recommended. Friction plus sweat plus residue is a recipe for clogged pores. For blackheads on the nose specifically, you may need extra patience because the nose has a high density of oil glands. Consistent salicylic acid use tends to help the most there, and retinoids can improve the surrounding texture over time. You may also notice what look like blackheads that never fully go away. Often these are sebaceous filaments, which are normal structures that line the pores and help move oil to the surface. They can look like tiny gray dots, especially on the nose and inner cheeks. You can reduce how noticeable they are with the same prevention routine, but they may not disappear entirely because they are a normal part of skin anatomy. This is an important reassurance: not every dot on the nose is a dirty pore that must be extracted. If blackheads are present on the chest or back, the routine principles are the same, but the skin can be thicker and may tolerate treatments differently. Showering after sweating is especially helpful. Consider cleansing the body area with a gentle wash and then using a leave-on salicylic acid product or a retinoid-type product designed for body acne if tolerated. Avoid harsh scrubbing with loofahs that can irritate hair follicles. Also pay attention to clothing. Tight synthetic fabrics and backpacks can create friction and heat that worsen congestion. Choose breathable fabrics when possible. One of the most overlooked aspects of prevention is consistency over time. Many people treat blackheads only when they are visible, then stop when they improve. But blackheads form gradually, and stopping the routine allows the pore lining to return to its previous pattern. Think of prevention like dental hygiene. Brushing once doesn't prevent cavities forever, it's the daily habit that keeps problems from returning. A sustainable routine you can keep going is far more effective than an aggressive routine you quit after 2 weeks. Here is how I recommend you introduce changes safely. Week 1 and 2, simplify. Use a gentle cleanser at night, moisturize, and wear sunscreen in the morning. If you wear makeup, ensure you remove it thoroughly. Once that feels comfortable, add one active ingredient. Weeks 3 and 4, introduce salicylic acid a few nights per week, or introduce a retinoid 2 nights per week, depending on your preference and skin sensitivity. Month 2, gradually increase frequency as tolerated. Month 3, evaluate results. Are blackheads less visible? Is texture smoother? Is your skin comfortable? If yes, continue. If you are irritated, reduce frequency and prioritize barrier support. If you are not improving at all, you may need a different strength, a different active, or professional guidance. Professional options can also be helpful, especially for stubborn blackheads or when you want faster cosmetic improvement. Dermatology offices can perform safe extractions, chemical peels, and prescribe topical medications that normalize pore behavior. These treatments are not magic, but they can accelerate progress when combined with good home maintenance. The key is that professional treatments work best as part of a prevention plan, not as a one-time rescue. Let's address safety and what not to do at home. Avoid using sharp tools or needles to open pores. Avoid harsh peeling solutions used without guidance. Avoid mixing multiple strong actives on the same night early on, such as a strong acid plus a retinoid plus a harsh scrub. This increases irritation and can lead to barrier breakdown, which often triggers more breakouts.